Okay, well, greetings everyone, and we want to welcome you to this panel discussion, which is sponsored by the Institute for Complementary and Alternative Medicine, and really has been organized by the Director of Research, Dr. Virginia Cowan. I'm Dr. Susan Gould-Fogerite. I'm the Director of Research for ICAM, and my background is microbiology and immunology. For a PhD, I've done a lot of basic science research for most of my career, and have come into doing integrative medicine and CAM research in the last 7 years, and now we're doing clinical research and doing it in a way that incorporates the basic all the way up to the clinical. So having an integrated approach to how we're doing research in complementary and alternative medicine. So today we would very much like to welcome our panelists and thank them so much for being here. We're hoping that Dr. Nancy Kadar will be coming in the next few minutes, but we'll start off with the panelists who are here. So I'm going to do Dr. Kim's bio first. First we have Dr. David Kim, who is a PhD. He's a national board certified acupuncturist and herbalist since 1997, and he's also a diplomate in acupuncture and Chinese herbology. After completing his doctorate at the New Jersey Institute of Technology, just down the street here, in biomedical engineering, he received postdoctoral training in physiology at New Jersey Medical School, part of our school. Dr. Kim further continued his education at Mercy College, becoming a licensed acupuncturist in New Jersey and New York. He's also an associate professor of pharmacology and physiology at New Jersey Medical School, considered amongst his peers as a pioneer in acupuncture and oriental medicine research. To date, Dr. Kim has published 39 articles in first-class journals and currently serves as an editorial reviewer for the American Journal of Physiology and Microcirculation. His particular interests lie in studying the effects of acupuncture on hypertension and postoperative pain, and he currently practices acupuncture and oriental medicine in Englewood Cliffs, New Jersey. And in fact, we're in a collaborative research, a clinical research study that's going to be starting with Dr. Kim and members of the Department of Anesthesiology relative to postoperative pain and inflammation. So very happy to be collaborating with Dr. Kim. Welcome, Dr. Kim. Next, we have Dr. Peter Kadar, who has been practicing acupuncture and traditional Chinese medicine for over 30 years. He's the owner and director of the Acupuncture Center of New Jersey in Morristown, and leads a team of 8 acupuncturists and wellness practitioners. He's the director of acupuncture at the Center for Complementary Medicine at St. Clair's Hospital in Dover. Peter served on the New Jersey Acupuncture Examining Board and was president of the Massachusetts Acupuncture Society. He's a graduate of the New England School of Acupuncture and the Nanjing College of Traditional Chinese Medicine in China, and Samra Institute in Los Angeles, where he received the degree of Doctor of Oriental Medicine. Peter's now focused on expanding the potential and possibilities for acupuncture and TCM, that's traditional Chinese medicine, in hospital settings, and inviting physicians, nurses, and hospital staff to appreciate the value of these ancient and powerful healing modalities. So we'd like to welcome Mr. Peter Kadar.
Thank you.
Kadar. And third, we have Ray Hoffman. And Ray has been a licensed acupuncturist and board-certified Chinese herbalist since 2004. At his private practice in Montclair, New Jersey, he specializes in the treatment of men's health issues, including infertility, urinary dysfunction, prostatitis, and the side effects of cancer treatment. He holds a Master of Science degree in Traditional Oriental Medicine from the Pacific College of Oriental Medicine, and a Bachelor of Science degree in Biology from the University of California at UC Davis. Ray is an adjunct professor in Chinese herbology and a clinic supervisor at the Eastern School of Acupuncture and Traditional Medicine. He's also a nationally certified sign language interpreter and a fluent user of American Sign Language. But we haven't asked him to sign this panel. So I guess we'll go with that. We'll rely on this today. Okay, his practice is fully accessible to the deaf and hard of hearing individuals. So that's an important point to know. People are seeking out someone who they can communicate with. They need these
Thanks for
sorts of
having me.
practices. So I'll read Dr. Kadar's bio when she shows up. Hopefully she will. And so with that, I think we'd love to just get started. And our first question for the panel is a statement and then a question. And that is that acupuncture is attributed to ancient traditions from China, something we know. How much of that tradition is represented in your practice? And do you feel responsible to uphold traditions, or are you empowered to evolve how you practice? So I'd actually like to, we'll start at the end and ask Dr. Kim about this first.
Yeah. See, I learned and was trained in traditional Chinese medicine, in short TCM. So when we diagnose these patients, I'm only use for TCM theory, which is taking the pulse, look at the tongue, and that kind of thing. And patients is when they come and they're taking the pulse, and not only taking the pulse is the pulse rate, also we look at the how is the quality of the pulse. And we look at the tongue because we believe tongue is connected inside of the organ. So we have some tools to evaluate patients. So I focus on the traditional Chinese way, but my office setting exactly same as conventional medicine office setting. So the way of approach is a little different, but our goal is same. We want to do patients to have, maintain, improve individual health.
Thank you, Dr. Kim.
You're welcome.
Peter, will you come next?
Yes, I was also trained in acupuncture and traditional Chinese medicine. My teacher was from China, Dr. James Tinyao So, very well-known acupuncture teacher in this country. And then I studied in China in a Chinese traditional medicine hospital. So I agree with everything Dr. Kim says. The traditional practice of acupuncture incorporates the ideas of qi, of yin and yang, of the flow of blood and the organs, and the differentiation between exterior and interior as defined by certain diagnostic signs, including taking the pulse, which is a very unique form of Chinese diagnostic medicine. It's not just the rate or the strength of the pulse, but the various positions of the pulse, how they relate to each other, and their qualities, which can range from being called slippery to thready to knotted, and they all indicate different classifications of TCM, of traditional Chinese medical disorders. And it's the role of the acupuncturist who practices this full scope of medicine to put it all together and come up with a unique TCM diagnosis, which could be something like deficiency of spleen qi or excess heat in the gallbladder. And these are not the same as anything in conventional or modern medicine, although they can be overlaid on top of conventional and common Chinese diagnoses, like, for instance, ulcers or asthma or like that. But it's the patient that is the focus of the treatment and not the condition itself. In my practice over the many years I've practiced, I do feel that there's a very powerful evolution of acupuncture and Chinese medicine in this country as we bring it into the so-called mainstream of medicine, where I know that I am much more likely to consider many other factors in the patient's medical history, in their lifestyle, and especially in the way they hold their illness or their wellness in terms of their emotion and psychological state. Chinese medicine is very good at entering into this question and into this conversation with the patient, but I believe that our understanding from the West of the way that people think and feel and their consciousness brings a much richer possibility when we blend these two together.
Great, thank you very much. And Ray, could we hear your ideas on this?
Yes. I too was trained in a traditional Chinese medicine approach at the college I went to, Pacific College, which ironically is in New York City, but the home campus is in San Diego, that's the name. But we did receive a thorough backing in traditional Chinese medicine, studied extensively patterns, which Peter alluded to with the sort of organ names of such as liver qi stagnation or so forth. We also studied the pulse and tongue and learned these very basic diagnostic techniques of traditional Chinese medicine. Interestingly, as I got more into the study of the medicine, and especially after I finished my core training at the school, I learned that the name traditional Chinese medicine is somewhat of a misnomer. It was actually a codification of thousands of years of many streams of medical understanding that were developed throughout Chinese history, and it wasn't until I think Mao Zedong in the early 50s codified all of these medicines into what is known as TCM, traditional Chinese medicine. So in a way, it is traditional in that it's based on all of these streams, but it's a very new medicine when you look at it in terms of the vast history of the medicine behind that and the number of different schools of thought that have contributed to that. Since my graduation from school, I've begun to study with other people that are actually followers of sort of different streams that were not necessarily part of traditional Chinese medicine. There's a whole Japanese medicine approach to acupuncture and Oriental medicine that departs from the traditional Chinese approach in certain key ways. There's a lot more focus on palpation of the abdomen and looking at various signs of the abdomen in their approach to disease, which I've been doing. I also had the fortune to mentor with a gentleman named Richard Riley, who actually turned over his practice to me when he retired, but he was doing a lot of work with a gentleman named, or with a practitioner named Dr. Tong, who has a whole other school or a theory of the medicine, and his actual acupuncture points are even depart from the ones that we learned, the 360 sort of classic points that you see on most of the maps of the human body. So that's been very interesting to me, and interesting because in China or in the East, most practitioners of Chinese medicine traditionally came to it from a lineage. They were apprenticed with a doctor who had apprenticed previous and back thousands of years. That was sort of the way it was done. And with the idea now of people going to these schools, it's a little bit of a departure, and I think I've come back a little bit to the traditional way of finding some of these teachers and made a bit of a hybrid of the sort of Western approach of kind of embarking on your own path, finding your vision, but also looking to some of these other traditions, ancient traditions, that may have been neglected from some of the TCM that is done for the most part and taught in most of the schools in our country.
Great. Thank you so much.
Mm-hmm.
And actually, maybe if we could do a little bit of a follow-up with David on that, then, since both of you talked a little bit more about how the practice has evolved for you and also this impact of these different streams. So David, how do you feel and to what degree are you utilizing other streams within your practice, or are you very much within one lineage, or do you kind of take some information from different types of practices, for instance the Japanese or the Korean or some of the more modern adaptations?
Yeah, because as I mentioned, I learned traditional Chinese medicine, but also I'm from Korea, so I know about Korean traditional medicine, very similar as Chinese traditional medicine. So I combined Korean traditional medicine as well as Japanese medicine, but excuse me, but the Chinese medicine is originate from China. So my diagnosis is based on traditional Chinese medicine way, but I combined other medicine together. See, I'm not ignore anything about other conventional medicine approach. See, when patients ask about, I have this kind of pain, and I have to bring radiologist report, of course, because when when I have that kind of report, or when I have more information about what kind of treatments patients receive and what kind of drug medication they are taking, that will help to make a plan about treatments. So, see, this traditional, the Chinese medicine, of course we have to treat in that way, but we need to integrate it with other conventional medicine. I focus that kind of thing, I combined with other medicine to get improve and maintain better health.
Thank you very much.
You know.
So let's go on to another thing that sort of segues nicely with this conversation, I think, and that is before the panel started, there was a conversation about some of the other aspects that are being utilized in the treatment. And so just, for the benefit of the audience, if you could just talk a little bit more about how you might integrate some of these other aspects of traditional Chinese medicine in your treatment. And this time, why don't we start with Ray?
Sure. Well, I certainly use as a core to my treatment acupuncture. I would say probably 100%, if not 99% of my patients who come to me are given acupuncture as part of their treatment. And I generally will do acupuncture initially alone without any other modalities offered, and in the thought that I'd like to just see, especially if it's a new patient who has never had acupuncture before, I want to see how they respond to the acupuncture alone. I mean, that's part of, I think, my background in Western science. I look at it almost as a control to make sure I'm seeing what is working. I mean, if I were to prescribe acupuncture and then throw herbs on top of that and have them, change their diet and everything all at once, I wouldn't necessarily know what is working. And I want to see how they're responding alone to the acupuncture. So I will often start in the initial treatment with just that. I mean, unless it's a glaring thing where, they're smoking 10 packs a week or something, and I would like to recommend that they might cut down on that, or something like that would be a recommendation. But generally not the herbal medicine, which I do quite often later. I want to see how they're responding initially to the one modality before I proceed. I do Chinese herbs. I actually do a lot with lifestyle recommendations, because the causes of disease, according to our practice, are integral to that. It's, there's not a separation between how a person is working in their environment at work and what kind of emotional state they're at with their loved ones and their family and coworkers, and the diet, the food they're putting in their body, the environment that they might be exposed to at work or at home or in their leisure activities and so forth. I certainly make a lot of recommendations to that. And I also do a lot with diet, because when we talk about herbs and medicinals in our medicine, we talk about the various properties of these medicines and their actions on the body, and there's not a separation between that and the energetics and the properties of foods that are taken in. Foods are just as medicinal, one could say. In fact, there are certain herbs that are foodstuffs, so there's a strong overlap there. So I will work with the person to see what they're eating and make recommendations as to how their diet can be more beneficial to bring them into better harmony with the universe and where their body is at.
Great, thank you so much. And Peter, what would you like to add?
Well,
to that?
first I want to know, in the audience, are there people here who've had acupuncture or encounters with acupuncturists? Okay, there are a few. And now I imagine with the wealth of information, people know a little bit about acupuncture. That occurs in almost every venue that I speak at. So I'm glad that some of you have they been good encounters? Positive? Yes, people are smiling, good. Good. So one of the things that I want to add that is an essential part of what I do as I bring together all that I've learned and continue to learn in the many years of practice is when I see a patient, unless they're in really, really acute pain, like acute sciatic pain or terrible migraine headache, or recently I had a pregnant woman who just couldn't stop throwing up, I always ask them, how would you like to feel? How would you like to be? And then what is getting in the way of you feeling what's possible for you? So I try to shift the conversation from the symptoms, which most people are very clear about their symptomatology. We're trained, health consumers are trained to focus on their symptomatology. There's so many ads on TV and people read all kinds of stuff on the web, and they go to doctors who are always focusing on the symptomatology, the blood work, the MRIs, whatever is showing up in a very specific way, that people forget what it's like to just feel well, to feel really well, feel energetic, feel rested, feel relaxed, feel, as Ray said, in harmony with their environment at work, their family, outdoors, and not living in the state of consistent anxiety and stress related to their health and related to other things which also relate to their health. So all of this is very pertinent information for me as their practitioner as I weave my way into who they are based partly on their symptoms, partly on the kind of pain that they have, or the menstrual irregularity, or the problems getting pregnant, or a lot of people come to me for one thing like headaches, and I find out that they have indigestion and reflux, and that they have joint pain and 30 pounds or 40 pounds overweight. So all of these health issues impact them. And I explain how acupuncture can help with the headaches if that's their primary concern, and it can also help with all their other issues, but not individually, not like one by one, but all together. And that the basis to start from is to ask them, how do they feel and how do they want to feel? And if they can access a time in their lives, 5 years ago, 10 years ago, 20 years ago, when they felt really well. And that is the beginning, hopefully or often, of a long-term relationship where I have patients who I've been seeing for years. And it doesn't mean I'm a bad acupuncturist because they haven't gotten better in all this time. It means that they really enjoy the relationship, the partnership that they've established with me, and they really enjoy the use of acupuncture and herbs and the way that I can help them with dietary and other instructions and recommendations to get them to feel as well as they possibly can. And I think this is the promise and the potential of acupuncture in this kind of medicine as we go forward and bring it into complementary alternative medicine in a hospital or integrative setting.
Thank you very much. And actually, that was my intention was to go into what some of the things that you have found that acupuncture can be helpful for. So maybe if, David, if you could address in your practice, what have you seen that acupuncture can be helpful for people?
Yeah, over the 50% of my patients relate with pain, lower back pain, neck pain, and shoulder pain. But I'm recently seeing more psychological issues, including depressions and anxiety and insomnia. The difference of acupuncture and oriental medicine compared with conventional medicine, we try to treat the symptom, but also we wanted to try to treat where are these symptoms from? So we want to try to the root of the symptom. So to get the root, I usually ask about lots of questions. Not only how your pain looks like, not that kind of thing. Of course, it's important, but I more like the ask about, see, what time you go to the bed, what time you wake up, kind of lifestyle. I think lifestyle is very, very important because we are seeing more chronic disease patients built on inappropriate lifestyle. So I ask about the question about see how many meals consumed per day, that kind of thing too. So I try to get all the information to try to treat the roots. So we can say that the compared to conventional medicine, acupuncture is work maybe slow because I ask the patients after first treatments, and then I ask about patients. I think you have to come back about a week later. Then patients say that, oh, I have to come back. Well, yeah, because we are not using any medication. The needle is only stainless needle without any medication. We try to make a balance of the human health, balance of the energy. So we need more treatments. However, when acupuncture works, the effectiveness of the treatments really lasts longer because we treat the root of the symptoms.
Right. Thank you so much for bringing that out. So this is a theme here of which I'm hoping is coming across of this being part of traditional Chinese medicine, of this really integrative approach to the human as a whole integrated being in the context of their social system as well as a whole person integrating body, mind, and spirit. And this is also typical of some of the other complementary and alternative approaches like yoga, for instance, and yoga and meditation. So, Ray, would you like to talk to us a little bit about your practice and what you've seen
Sure.
the acupuncture being helpful for?
I, like Dr. Kim, treat a great many people that come to me with pain. Interestingly, it seems that a lot of people come to acupuncture as a last resort, I've noticed. When I talk to my patients and I ask them their story, I like to get the full story. Often they're not given the space for that in other modalities they've experienced. But when I unravel that, I like your analogy of us weaving into their life. I think that's very elegant. But I find out that they've gone to so many other places before. I mean, maybe they've tried conventional Western MD, and then they've tried chiropractic, and they've tried other specialists that have given them different suggestions and treatments that haven't, or maybe have worked to a certain degree, but not enough to give them a sense that they have been relieved to their satisfaction. So they come to acupuncture and Chinese medicine, and finally the key is unlocked for them for many of these chronic conditions that don't seem to have been answered by other approaches. I do a lot of work with pain in my practice as a sign language interpreter. With that background, I initially was doing a lot of work with interpreters with a lot of overuse syndrome in their upper limbs and neck with tension and also emotional stress. A lot of interpreters are put into very emotionally fraught situations where they're not allowed, because of the ethics of the practice of the profession, to disclose that information. So they're holding on to a lot of very toxic, damaging, emotionally laden information that they can't do anything with. So it's lodged in their psyche. So we can work a lot with them to help them help their body to heal that and resolve that. I came into the work with men's issues sort of not by plan. I was working with a colleague in my town who does a lot of work with women that are going through infertility and wanting to get pregnant, and she was referring a lot of her male patients, the partners of these women, to me for some male infertility issues, and then also got into treating a few patients for prostate problems. They were receiving prostate treatment, but they were having side effects from the medications and some of the treatments, and were wanting some help in a different way. So I helped them to wean themselves of some of these other medications that were causing them distress, and have come to really enjoy working with that population as well.
Okay, thank you so much. So actually, pain is certainly a major focus. We see that listed as a major application. And you mentioned a little bit about the side effects from cancer therapy. Would anyone else like to say a little bit about
Yes.
that sort of thing?
Sure. I do treat people often who, for side effects of chemotherapy specifically. At the hospital St. Clair several years ago, we had a grant to treat women who were going through treatment for breast cancer and had the common side effects of nausea, early menopause, hot flashes, and headaches, fatigue, neuropathy. And acupuncture is very good for helping with that, for helping with the symptoms because it's a very powerful regulatory stimulation. So it helps the body to replace what is being damaged by these strong chemotherapeutic agents to gently begin to restore function. So people, for instance, with peripheral neuropathy, a lot of pain and numbness and discomfort and difficulty walking, found that the acupuncture helps to stimulate and regenerate the nerve flow to the extremities. Acupuncture very quickly can help with nausea as a result of chemotherapy. And most patients say that it really helped them to relax, to have more energy, to sleep better, and helped along with the other things they were doing to put them in a better frame of mind and a better mood about the treatment they were going through, and it helped to allow them to go through the treatment easier and more gracefully. Mm-hmm. And this is one of the things that we want to bring more often into the hospitals, because it's a very easy treatment to do. A patient can be treated in their chair with just some points in the ear, a few in the wrists and the hands, a few in the feet and the legs. And it could be very common treatment before and after chemotherapy. I also treat a lot of women for infertility, whether they're going through assisted reproductive techniques like IUI or IVF, or they want to do it on their own. And acupuncture and Chinese herbal medicine is very, very helpful for that, a very high incidence. And many doctors refer their patients to me, reproductive specialists, and many reproductive specialists have hired acupuncturists to work in their clinic, and especially with acupuncture treatment right before and right after the embryo transfer.
Mm-hmm.
Mm-hmm. And David, would you like to say a little bit about surgery, about the use of acupuncture and surgery, maybe?
Yeah. Ray mentioned about Peter. Peter mentioned about the nausea and vomiting, and also the acupuncture treatment before in vitro system. That those kind of the benefits of those systems is already, there are lots of publication. So there is a scientific background too. And also people is interesting about also we in UMDNJ, we are planning to do research, which is how acupuncture is going to be helped after post surgery. So we are going to be looking for after acupuncture before the surgery and during the surgery and after surgery, with acupuncture treatments is going to be help, is going to be reduce inflammation, also is going to be reduce consumption of pain medication. People is also very interested about in that area as a complementary and alternative medicine of the benefit of the acupuncture. And a lot of people is interested about the research in acupuncture-oriented medicine. And not only for, I mentioned about nausea and vomiting, but there are a lot of scientific background publication about low back pain and the neck pain and shoulder pain. And so the people is very interested about how acupuncture works. Wanted to know about, what is the mechanism of acupuncture. How people is more interested about the more than ever about receiving acupuncture now. People just wanted to know how acupuncture works.
Okay. Thank you. Thank you very much. And so as time always flies when you're having fun, it is actually time for us to wrap up this part where I'm actually asking the questions. So we want to thank our panelists so much for these very detailed and
Thank you.
inspiring answers. And just thank you all for coming here today, and encourage you to continue to look into these sorts of complementary and alternative medicine modalities, and to visit our website at the Institute for Complementary and Alternative Medicine, and be free to contact us for your interests in this and our wonderful master's program that we have, and particularly Dr. Cowan for that. So thank you for this part, and then we're going to now turn it over to the audience for questions.